Hello everyone, and welcome back to the channel. Today, we're talking about a topic that touches millions of lives, yet is often misunderstood: heart attacks. We all have this classic image in our heads, right? Someone clutching their chest in dramatic pain. But the reality is far more complex and, frankly, far more hidden. What if I told you that a heart attack could feel like the flu, or just a bit of indigestion? What if I told you the real dangers aren't just about surviving the initial event, but about what comes after? In the next 10 minutes, we're going to uncover the hidden dangers of heart attacks, from the silent symptoms that often get missed, to the long-term consequences that can change your life forever. This isn't just about scary statistics, it's about giving you the knowledge to protect yourself and the people you love. So stick around, because what you learn today could literally save a life. First, let's get on the same page. What exactly is a heart attack? Put simply, it's a plumbing problem. Your heart is a muscle, and like any muscle, it needs a constant supply of oxygen-rich blood to function. This blood is delivered through a network of pipes called coronary arteries. A heart attack, or myocardial infarction, happens when one of these arteries becomes blocked, usually by a blood clot that forms on top of a plaque buildup. Think of it like a clog in a pipe. When that flow is cut off, a part of the heart muscle starts to die. The severity of the heart attack depends on how big the blockage is and how long it lasts. Time is muscle, as cardiologists say. The faster you can get that artery opened, the less damage is done. Now, let's talk about the first hidden danger: the symptoms. We've all been conditioned to look for crushing chest pain, often described as an elephant sitting on your chest. And yes, that is a classic symptom, especially for men. But it's not the only one, and this is where things get tricky. Many people, particularly women, older adults, and individuals with diabetes, experience what are called atypical symptoms. These can be incredibly subtle and easy to dismiss. For example, you might feel extreme, unexplained fatigue. Not just "I'm a little tired" fatigue, but a profound exhaustion that makes simple tasks feel impossible. You could also experience shortness of breath, even without any chest discomfort. It might feel like you just can't catch your breath, whether you're resting or doing light activity. Other sneaky signs include pain in your jaw, neck, back, or even in one or both arms. It might not be a sharp pain, but more of a dull ache or pressure. And then there are the symptoms that mimic digestive issues: nausea, vomiting, indigestion, or heartburn-like feelings. Because these signs are so common and can be attributed to so many other things, people often wait too long to seek help, thinking it's just stress or something they ate. This delay is one of the biggest hidden dangers, because every minute that passes means more heart muscle is lost. So, let's say someone recognizes the signs, gets to the hospital, and survives the heart attack. That's the end of the story, right? Far from it. This brings us to the next set of hidden dangers: the long-term consequences. A heart attack is not a one-time event, it's a chronic condition that requires lifelong management. The damage to the heart muscle can be permanent. This damaged tissue turns into a scar, and scar tissue doesn't contract like healthy heart muscle. This can weaken the heart's pumping ability, leading to a serious condition called heart failure. With heart failure, your heart can't pump enough blood to meet your body's needs. This can cause symptoms like persistent fatigue, swelling in your legs and ankles, and severe shortness of breath, dramatically impacting your quality of life. Imagine being unable to walk up a flight of stairs or carry your groceries without getting winded. That's the reality for many heart attack survivors. Another hidden risk is an increased chance of developing arrhythmias, or irregular heartbeats. The scarring from a heart attack can disrupt the heart's electrical system, which is what coordinates your heartbeat. Some arrhythmias are harmless, but others can be life-threatening, increasing the risk of stroke or sudden cardiac arrest. This is why many survivors need to take medication or even have a device like a pacemaker or an implantable cardioverter defibrillator, an ICD, implanted to keep their heart rhythm in check. It's a constant reminder of the event and a source of ongoing medical care. But the dangers aren't just physical. One of the most overlooked consequences of a heart attack is the psychological and emotional toll. Surviving a life-threatening event is traumatic. Many people develop anxiety, depression, or even post-traumatic stress disorder. There's often a profound fear that it could happen again. Every little ache or pain can trigger a wave of panic. This cardiac anxiety can be debilitating. Patients might become afraid to exercise, to travel, or to be alone. This fear can lead to social isolation and a cycle of inactivity that's actually bad for their heart. Depression is also incredibly common, affecting up to 1 in 3 heart attack survivors. It's not just feeling sad, it's a clinical condition that saps your energy and motivation, making it harder to stick with the lifestyle changes and medications that are crucial for recovery. It's so important to recognize that your mental health is just as critical as your physical health during recovery. So, what can we do about all this? Knowledge is power. The first step is prevention. Up to 80% of heart disease is preventable. This means managing your risk factors, keeping your blood pressure and cholesterol in check, not smoking, maintaining a healthy weight, eating a balanced diet rich in fruits and vegetables, and getting regular exercise. It's the advice we've all heard a million times, but it truly is the foundation of heart health. And please, get regular checkups with your doctor to know your numbers. The second step is to not ignore symptoms. If something feels off, even if it's not the classic Hollywood heart attack, get it checked out. It is always better to be safe than sorry. Call for emergency medical help immediately. Don't try to drive yourself to the hospital. Emergency medical services can start treatment on the way, saving precious heart muscle. And finally, for those who have survived a heart attack, recovery is a journey, not a destination. Embrace cardiac rehabilitation. It's a medically supervised program that includes exercise training, education on heart-healthy living, and counseling to reduce stress. It's been proven to reduce the risk of a future heart attack, improve quality of life, and help manage the emotional fallout. And don't be afraid to talk about your feelings. Seek support from your family, friends, a support group, or a mental health professional. Remember, if you are struggling with your mental health, reaching out is a sign of strength. There are resources available, and you don't have to go through it alone. The story of a heart attack doesn't end when you leave the hospital. The hidden dangers, the atypical symptoms, the risk of heart failure and arrhythmias, and the heavy emotional toll are a crucial part of the picture. By understanding these risks, we can be better prepared to prevent heart attacks, recognize them when they happen, and support a full and healthy recovery for ourselves and our loved ones. Thank you so much for watching. I hope this information was helpful and empowering. If you found value in this video, please give it a thumbs up and share it with someone you care about. And don't forget to subscribe and hit that notification bell so you don't miss our future videos on health and wellness. Stay safe, stay informed, and take care of that amazing heart of yours. See you in the next one.
Hey everyone, welcome back to the channel. Today we're tackling a super important topic, heart attacks. There's so much misinformation out there, and what you don't know can be dangerous. So let us bust some common myths and get to the real facts that could save a life, maybe even your own. First up, the biggest myth of all, heart attacks only happen to old, overweight men. This is absolutely not true. Heart disease is the #1 killer of women, and it can affect people of all ages, shapes, and sizes. Young, fit people can have heart attacks too, especially if there's a family history or other risk factors like smoking or stress. So, no matter who you are, it's crucial to know the signs. Next, let's talk about those signs. You've probably seen it in movies. A person clutches their chest dramatically and falls to the floor. While severe chest pain is a classic symptom, it's not the only one, and sometimes it's not even the main one. A heart attack can feel like intense pressure, squeezing, or fullness in the chest. But it can also show up as pain in your jaw, neck, back, or arms. You might feel short of breath, break out in a cold sweat, or get really dizzy and nauseous. For women, especially, the symptoms can be much more subtle, like unusual fatigue, indigestion, or anxiety. The key takeaway here is this: if something feels really wrong, don't ignore it just because it's not the Hollywood heart attack. Myth number 3, it's probably just heartburn. This is a dangerous assumption. Yes, heartburn can cause chest discomfort. But the pain from a heart attack is often described differently, more like pressure than a sharp, burning feeling. Heart attack pain usually gets worse with activity and doesn't get better with antacids. The risk of confusing the two is just too high. If you have chest pain and you're not sure what it is, especially if you have other symptoms we mentioned, it's always better to be safe than sorry. Don't wait to see if it goes away. Call for emergency help immediately. Okay, another common one. I'm too young to worry about my cholesterol. Nope, false again. The process that leads to clogged arteries, called atherosclerosis, can start in childhood. High cholesterol often has no symptoms, so you could have it for years without knowing. Getting your cholesterol checked, even in your 20s and 30s, is a smart move, particularly if you have a family history of heart disease. Your doctor can help you understand your numbers and what they mean for your long-term health. Making healthy lifestyle choices now, like eating a balanced diet and staying active, can make a huge difference down the road. Myth number 5. If you have a heart attack, you should cough repeatedly and vigorously. You might have seen this one in a chain email or on social media. It's called cough CPR, and the idea is that it can keep blood flowing to the brain. This is a persistent and dangerous myth. The American Heart Association does not endorse cough CPR for a person who is having a heart attack. If you're conscious and think you're having a heart attack, the absolute most important thing to do is call 911 or your local emergency number immediately. Don't try to drive yourself to the hospital. Chew an aspirin if a dispatcher tells you to, but the priority is getting medical professionals on their way to you as fast as possible. Every second counts. Let's move on to another misconception. Stents and bypass surgery cure heart disease. While these procedures are amazing, life-saving treatments that restore blood flow to the heart, they are not a cure. They fix the immediate plumbing problem, but they don't reverse the underlying disease that caused the blockage in the first place. Think of it like this. If your pipes are rusting, a plumber can replace a clogged section, but the rest of your pipes are still at risk. After a procedure, you still have heart disease. That's why lifestyle changes are so critical. A heart-healthy diet, regular exercise, quitting smoking, and managing stress are your best tools for preventing another event and keeping your heart strong for the long haul. Myth 7. I'll know if I have high blood pressure. This is why high blood pressure is called the silent killer. Much like high cholesterol, it usually has no warning signs or symptoms. You can feel perfectly fine and still have dangerously high blood pressure that is damaging your arteries and your heart over time. The only way to know for sure is to get it checked regularly. It's quick, painless, and you can even do it at many pharmacies. Knowing your numbers is the first step to getting it under control, either through lifestyle changes or with medication if your doctor recommends it. Don't assume you're fine just because you feel fine. Here's a myth for the fitness enthusiasts. I exercise so I can eat whatever I want. I wish this were true. But unfortunately, you can't outrun a bad diet. While exercise is fantastic for your heart and overall health, it doesn't give you a free pass to eat tons of junk food. A diet high in saturated fat, trans fat, sodium, and sugar can still lead to high cholesterol, high blood pressure, and inflammation, which all contribute to heart disease, regardless of how many miles you run. A healthy lifestyle is a combination of both regular physical activity and a nutritious, balanced diet. They work together to protect your heart. And our final myth for today. Taking a small daily dose of aspirin is a good idea for everyone to prevent a heart attack. For a long time, this was common advice. However, recent guidelines have changed. While a daily aspirin may be beneficial for people who have already had a heart attack or stroke, for many others without known heart disease, the risks of bleeding can outweigh the potential benefits. This is a perfect example of why you should never start a new medication, even an over-the-counter one, without talking to your doctor first. They can assess your individual risk factors and help you make the best decision for your health. So let's recap the facts. Heart attacks can happen to anyone. The symptoms aren't always obvious chest pain. Never dismiss chest pain as just heartburn. It's never too early to think about your heart health. If you think you're having a heart attack, your first and only move should be to call for emergency help. And finally, medical procedures and exercise are powerful tools, but they don't replace an overall healthy lifestyle. Understanding these truths is the first step toward protecting yourself and the people you love. If this video helped clear things up for you, please give it a thumbs up and share it with your friends and family. It's information everyone needs to have. Don't forget to subscribe for more health facts and myth busting. Thanks for watching, and take care of that heart.
Hey everyone, and welcome back to our channel. Today, we're tackling a topic that could literally save a life, maybe even your own. We're talking about the top 5 signs of a heart attack. Now, I know what you might be thinking. A heart attack is always that dramatic, chest-clutching moment we see in movies, right? Well, not always. The signs can be surprisingly subtle, especially in women, which is why it's so crucial to know what to look for. Ignoring these symptoms can have devastating consequences, so let's get educated together. This isn't about scaring you, it's about empowering you with knowledge. Let's dive right into our first and most well-known sign, chest discomfort. This is the classic symptom. Most heart attacks involve discomfort in the center of the chest that lasts for more than a few minutes, or it may go away and then come back. It can feel like uncomfortable pressure, squeezing, fullness, or pain. It's often described as an elephant sitting on your chest. But here's the key part many people miss: it's not always a sharp, sudden pain. It can be a slow buildup of pressure. You might even dismiss it as heartburn or indigestion. That's a dangerous mistake. If you feel a persistent, unusual pressure or pain in your chest, don't just brush it off. It's your body's #1 alarm bell, and you need to listen to it. Moving on to sign number 2, and this is one that surprises a lot of people: discomfort in other areas of the upper body. A heart attack isn't just about the chest. The pain and discomfort can spread or radiate to other places. You might feel symptoms in one or both arms, often the left arm, but it can be the right one too. The pain might travel to your back, neck, jaw, or even your stomach. For example, you could feel an aching pain in your jaw that you might mistake for a toothache. Or you might feel intense pressure between your shoulder blades. This is especially common in women, who often report back or jaw pain as their main symptom, sometimes without any severe chest discomfort at all. So remember, unexplained pain in any of these upper body areas is a serious red flag. Sign number 3 is shortness of breath. This can happen with or without chest discomfort. You might feel like you just ran a marathon, even though you've only walked up a few stairs or are just sitting down. You might be struggling to catch your breath or take a deep breath. This happens because the heart attack is affecting your heart's ability to pump blood, which in turn affects the oxygen supply to your lungs and the rest of your body. Sometimes, shortness of breath is the very first sign you'll notice, even before any pain sets in. If you suddenly find yourself breathless for no apparent reason, pay close attention. It's a critical clue that something is wrong with your cardiovascular system. Don't just assume you're out of shape or having an anxiety attack. It could be much more serious. Now for sign number 4, which is a collection of other, often overlooked symptoms. These can include breaking out in a cold sweat, nausea, or lightheadedness. Imagine suddenly feeling clammy and sweaty, even though the room is cool. Or perhaps you feel an overwhelming wave of nausea, like you're about to be sick, sometimes leading to actual vomiting. You might also feel dizzy, lightheaded, or like you're about to faint. These symptoms occur because your brain and nervous system are reacting to the stress your heart is under. On their own, You might dismiss them. A cold sweat? Maybe I'm just nervous. Nausea? Maybe it's something I ate. But when these symptoms appear alongside any of the others we've discussed, or come on suddenly and intensely, they form a bigger picture. They are part of the body's emergency alert system. Finally, let's talk about sign number 5, extreme and unusual fatigue. We all get tired, but this is different. This is a profound, unexplained exhaustion. It's the kind of fatigue that can come on suddenly, or over a period of days. You might feel so tired that you can't do simple, everyday activities, like making the bed or walking to the mailbox. This is another symptom that is particularly common in women. They might feel deeply tired for days or even weeks leading up to a heart attack. It's your heart struggling to pump, and your body is feeling the strain. If you're experiencing a level of tiredness that feels completely abnormal for you, and you can't explain it, please don't ignore it. It's not just being tired. It's a potential signal that your heart is in distress. So, to recap, the 5 key signs are 1. Chest discomfort, 2. Pain in the arms, back, neck, jaw, or stomach, 3. Shortness of breath, 4. Cold sweats, nausea, or lightheadedness, and 5. Extreme fatigue. It's important to know that you might not experience all of these signs. You might only have 1 or 2. And the symptoms can vary greatly between men and women. The most important thing is to listen to your body and trust your instincts. If something feels wrong, it probably is. Now, what should you do if you or someone around you is experiencing these symptoms? The answer is simple and urgent. Call for emergency medical help immediately. In the US, that's 911. In the UK, it's 999. Know your local emergency number. Do not, and I repeat, do not try to drive yourself to the hospital. Why? Because you could lose consciousness on the way, endangering yourself and others. Paramedics can start life-saving treatment the moment they arrive. Every single second counts when it comes to a heart attack. Time is muscle. The longer you wait, the more heart muscle is damaged or dies. While waiting for help, it's often recommended to chew and swallow an aspirin, as it can help thin the blood, but only if you're not allergic or have been told by a doctor not to take it. Understanding the risk factors is also a huge part of prevention. Things like high blood pressure, high cholesterol, diabetes, smoking, obesity, and a family history of heart disease all increase your risk. But the good news is that many of these are manageable. Regular checkups with your doctor are essential to keep an eye on your numbers. A healthy diet, regular exercise, and not smoking are powerful tools in your arsenal to protect your heart health for the long term. Prevention is always better than cure. Taking small, consistent steps to live a healthier lifestyle can make a world of difference. We've covered a lot of serious information today, but the goal here is empowerment. Knowing these signs means you can act quickly and decisively in a crisis. It means you can advocate for yourself or a loved one when seconds matter. Please share this video with your friends, your family, your parents, your partners. Spreading this knowledge could genuinely save a life. Don't be afraid to talk about it. It's a conversation that everyone needs to have. Thank you so much for watching. If you found this information helpful, please give this video a thumbs up and consider subscribing to our channel for more content that helps you live a healthier, more informed life. Hit that notification bell so you never miss an update. Stay safe, listen to your body, and take care of that amazing heart of yours. See you in the next video.
Hello everyone, and welcome back to the channel. Today we're tackling a serious but incredibly important topic: how to survive a heart attack. Knowing what to do in those critical moments can literally be the difference between life and death. This isn't just about you. It's about being prepared to help your loved ones too. So let's dive into the life-saving tips and strategies that everyone should know. First, let's talk about recognizing the signs. It's not always the dramatic chest-clutching scene you see in movies. Symptoms can be subtle and vary between men and women. The most common sign is chest discomfort. This can feel like pressure, squeezing, fullness, or pain in the center of your chest that lasts more than a few minutes, or that goes away and comes back. But there are other signs to watch for. You might experience pain or discomfort in one or both arms, your back, neck, jaw, or even your stomach. Shortness of breath can occur with or without chest discomfort. Other possible signs include breaking out in a cold sweat, nausea, or lightheadedness. Women are somewhat more likely than men to experience some of the other common symptoms, particularly shortness of breath, nausea and vomiting, and back or jaw pain. Don't dismiss these signs. Your body is trying to tell you something is seriously wrong. So, what do you do if you think you or someone else is having a heart attack? The first and most crucial step is to call for emergency medical help immediately. In the US, that's 911. In the UK, it's 999. Know your local emergency number. Don't waste time trying to wait it out or convince yourself it's just indigestion. Every single second counts. Heart muscle is dying, and the faster you get treatment, the more heart muscle can be saved, and the better your chance of a full recovery. Don't attempt to drive yourself to the hospital. Call an ambulance. Emergency medical services can begin treatment the moment they arrive, which is much faster than if you drive. While you're waiting for help to arrive, there are a few things you can do. First, stop whatever you're doing and sit or lie down. Try to get into a comfortable position. Loosen any tight clothing around your neck. This helps reduce the strain on your heart. You want to stay as calm as possible. I know that's easier said than done, but deep, slow breaths can help manage panic, which can make the situation worse. Next, if you're not allergic and don't have a condition that makes bleeding a risk, chew and swallow an aspirin. A standard 325 mg non-coated aspirin is best. Aspirin helps to thin the blood and can help break up the blood clot that is causing the heart attack. Chewing it instead of swallowing it whole helps it get into your system faster. But please only do this if a doctor has previously told you it's okay, or if the emergency dispatcher instructs you to. If you've never discussed this with your doctor, wait for the paramedics. If the person having the heart attack becomes unconscious and stops breathing, this is when CPR comes in. If you are trained in CPR, now is the time to use it. If you're not trained, the emergency dispatcher can guide you through hands-only CPR. You just need to push hard and fast in the center of the chest. This can keep blood flowing to the brain and other organs until medical help takes over. Knowing CPR is an invaluable skill. I highly recommend everyone take a certified course. You can find them through organizations like the American Heart Association or the Red Cross. Now, let's talk about what happens once you get to the hospital. The medical team will work fast. They'll likely perform an electrocardiogram, or ECG, to check your heart's electrical activity. They'll also take blood tests to look for proteins that indicate heart muscle damage. Depending on the type and severity of the heart attack, treatments can range from medications to dissolve clots to procedures, like angioplasty, where a small balloon is used to open the blocked artery and a stent is often placed to keep it open. In more severe cases, bypass surgery might be necessary. The key takeaway here is that modern medicine has incredible tools to treat heart attacks, but they are most effective when used quickly. After surviving a heart attack, the journey isn't over. Recovery and prevention of future events are just as important. This phase is often called cardiac rehabilitation. It's a medically supervised program designed to improve your cardiovascular health. It typically includes three main parts: exercise counseling and training, education for heart-healthy living, and counseling to reduce stress. Let's break that down. Exercise is vital. Your doctor will help you figure out a safe way to get active again. It might start with short walks and gradually increase in intensity. The goal is to strengthen your heart and improve your overall fitness. Education is another huge piece of the puzzle. You'll learn about healthy eating, like reducing salt, saturated fats, and cholesterol, and adding more fruits, vegetables, and whole grains to your diet. You'll also learn about the medications you've been prescribed, It's crucial to take them exactly as directed. These drugs can help lower your blood pressure, reduce cholesterol, and prevent clots. Never stop taking a medication without talking to your doctor first. And finally, managing your emotional health. It's completely normal to feel scared, anxious, or depressed after a heart attack. It's a major life event. Counseling, support groups, and stress reduction techniques like meditation or yoga can be incredibly helpful. Don't be afraid to talk about your feelings with your family, friends, or a mental health professional. Taking care of your mind is just as important as taking care of your heart. If you're struggling, remember that resources are available, and seeking help is a sign of strength. In summary, learn the signs of a heart attack and don't ignore them. Call for emergency help immediately. While waiting, stay calm, sit down, and chew an aspirin if it's safe for you. Learn CPR, and after a heart attack, fully commit to your cardiac rehab program exercise. Eat right, take your meds, and manage your stress. This information can truly be life-saving. Please share this video with your friends and family. The more people who are prepared, the more lives we can save. Thank you so much for watching. If you found this helpful, give it a thumbs up. And don't forget to subscribe for more content to help you live a healthier, safer life. Stay safe, and we'll see you in the next video.